Hello, this is our 450 final project presentation, and we are going to talk about the importance of hand hygiene in healthcare and why it continues to be a challenge, made by CJ, Haley, Yolanda, and Ryan. Hand hygiene is one of the easiest and most effective ways to prevent the spread of infection among healthcare workers and patients. Something as simple as washing hands can significantly reduce the risk of disease. In hospitals, especially, proper hand hygiene plays a major role in reducing cross-infection between patients. However, even though its importance is well known, many healthcare professionals do not always follow proper hand washing guidelines. This lack of consistent compliance remains a serious issue in healthcare settings. Over the years, several efforts have been made to improve hand hygiene compliance. Some of these strategies have worked for a short time, but unfortunately, most have not led to long-lasting behavior change. To better understand what influences hand hygiene behavior, researchers are now using a method called a factorial survey research design. This approach combines different factors into realistic scenarios or vignettes, which allows researchers to evaluate multiple influences on decision making at the same time. By using this method, healthcare organizations can better identify what truly impacts hand hygiene compliance and develop stronger, more lasting solutions to protect both patients and healthcare workers. Now let's talk about the background. Hand hygiene has proven to be one of the most effective ways to prevent infections, yet compliance remains low across the world. Even though healthcare workers understand how important hand washing is, many still struggle to follow proper guidelines consistently. Research shows that multi-component interventions, meaning strategies that use more than one method at the same time, are more effective at improving hand hygiene than single approaches alone. These may include education, reminders, leadership, support, and easier access to hand sanitizers. This study uses a factorial survey design based on social cognitive theory to test multiple factors at once. This approach helps researchers understand how personal beliefs, the work environment, and social influences affect hand hygiene behavior. The study also uses vignette-based surveys, which are cost-effective, flexible, and allow for larger sample sizes compared to traditional observational studies. This makes it easier to collect a wide range of data efficiently. Although previous vignettes-based studies have been examined behavior in other healthcare settings, none have specifically focused on nurse-designed hand hygiene interventions. This is what makes this study unique. One of the main goals of this study is to involve nurses directly in designing these interventions, since they are often left out of policy development. By including nurses in the process, the study aims to create more realistic, practical, and effective solutions for improving hand hygiene compliance.
The problem being solved in this study is that the compliance rate of hand hygiene in acute care facilities is far less than optimal, despite it being the most effective and the most simple means of mitigating care-acquired infection rates. Specific limitations in coordinating successful methods for the improvement of hand hygiene include a lack of controlled studies, inconsistent reporting, and insufficient detail given for these interventions to be replicated further. Poor hand hygiene in care facilities can lead to the spread of a lot of deadly germs, including those resistant to antibiotics, meaning that they will be harder to treat. And this can be spread from staff to patients as well as from patients to staff. It can cause unnecessary treatments and even patient or provider death. Many changeable circumstances are involved in poor hand hygiene, and it is important to identify the issues that we have the power to address. And in the bottom right corner, you can see that there is a pretty standard protocol for when providers should be practicing hand hygiene.
This study was conducted in an acute care hospital setting across the United States. The participants included nurses working at least 30 hours a week and providing 50% or more direct patient care. The nurses represented a variety of inpatient unit care, including medical surgical, ICU, emergency, cardiac, and other acute care specialty. Although medication use was not part of this project, the study did focus on infection prevention and overall patient safety, specifically observing hand hygiene compliance. The setting, again, was acute care hospitals, nurses working frontline, and the routine hand hygiene practices performed during patient interactions. There were 5 steps to the procedures and interventions of these. Step 1 being identification of key factors. This identified modifiable factors that could influence hand hygiene compliance. They would analyze data from previous nurse interviews, reviewing existing hand hygiene intervention studies, and consulted experienced clinical professionals. Step 2 being the development of beignets. The team created these by describing a nurse working in a busy hospital unit under different conditions related to hand hygiene compliance. They also served as controlled scenarios to evaluate how various factors might affect compliance. Step 3 is the recruitment of participants. It was again nurses who worked across the U.S. that were recruited if they met these criteria, working at least 30 hours a week and spending at least 50% of their time in direct patient care. Step 4 being the survey administration. Each participant received 8 randomized beignets. Nurses rated each scenarios on a scale of 0 to 10, indicating how likely they described conditions would improve hand hygiene compliance. Step 5, being the final step, was open-ended feedback. After scoring these, the nurses would provide open-ended comments describing additional strategies or conditions they believed would improve hand hygiene. So the process measure is availability and refill status of hand hygiene dispensers. The structure for this could be routine check performed daily or each shift, and the documentation of refill times. The reasoning for this is ensuring that the dispensers are full and accessible, removing a major barrier to compliance. The outcome measure for this is hand hygiene compliance rate. The structure is measured through direct observation and product usage tracking, understanding when it would be frequently useful to refill them. So data collection methods and data collected would be online surveys that were administered to nurses nationwide. Each nurse did receive 8 random beignets. They are open-ended responses and were collected for additional recommendations. The data collected was quantitative beignet scores rating the likelihood of improved compliance, qualitative, the narrative feedback describing perceived motivators and barriers, and then demographic data, which is unit type, work hours, experience level, and geographic region. So why is this important? Hand hygiene is an essential to prevent healthcare associated infections and maintaining patient safety. Nurses do have the highest amount of patient contact, making their compliance critical in reducing infection risk for patients and themselves. This will also highlight overlooked issues being empty or poorly maintained dispensers that can be easily fixed. And this will support meeting the compliance goals by putting hand hygiene into practice.
So some strengths and weaknesses that I did see throughout the articles is that mostly they do want to highlight what actually matters to the nurses. And the study does a great job by identifying specific things like their clear goals, supportive supervisors, monitoring patients, and most likely rewards. This does truly influence nurses' hand hygiene habits. They also do have some strengths that are grounded in real behavior theory. They do this by using the social cognitive theory. This helps explain why nurses act the way they do, instead of just measuring whether they follow the rules. Next, another strength is that they are flexible and practical study design. The vignette approach allows the authors to test several factors at once without interrupting clinical work, which makes the findings more manageable and cost-effective. Last, nurses' voices are also included. This is just one of the biggest strengths, that nurses are directly involved in shaping possible solutions, than rather just being left out of the decision-making and process. And then some weaknesses that I did see is what people say versus what people actually do. Since the study is use hypothetical scenarios, nurses may respond differently than how they behave during busy or stressful shifts. Next weakness is not all hospitals are the same. So this results from one acute care setting, which might not apply everywhere, but different units have different cultures, layouts, and staff realities. Next weakness is the environmental barriers, which deserve more attention. Nurses pointed out simple issues like empty dispensers and workflow challenges, but the study mainly focused on motivational factors, which are the real-world obstacles, which might be just as important. And then the last weakness is the short-term perspective. The study identifies helpful factors, but it doesn't show whether these strategies actually create a long-lasting change, which has been a major struggle in hand hygiene research. So these are just some personal comments, some limitations, and then just some next steps moving forward. We do appreciate that the authors focus on a lot of the nurse involvement, which makes the recommendations feel a lot more realistic and grounded for a lot of the day-to-day work environment for them. At the same time, relying heavily on self-reported answers can also be very misleading because compliance often drops in real clinical situations. So we would have liked to see more emphasis on practical fixes, but sometimes the biggest barriers are physical and not motivational. And then some future work and some next steps that we are looking at is to first test these strategies in real hospital units. We'll do this by implementing goals, monitoring patients, and supervising support in practice and measure if compliance actually improves over the several months. Next, we want to address environmental fixes alongside motivation. We'll do this by combining behavior strategies with simple but meaningful changes like the better dispensing placement and ensuring supplies are always stocked. Next, we do also want to expand the research to more settings. We'll do this by comparing results across ICU, outpatient clinics, long-term care, or even different hospital systems just to see if the same factors matter everywhere. Lastly, we do also just want to study long-term impact for us. We'll do this by looking at whether these interventions maintain behavior change or not just create temporary improvements.
Though hand hygiene seems like a pretty straightforward and easy practice, the methodology and processes for improving hand hygiene comes with both risks of physical and cultural barriers within facilities. This study found compelling concerns which included physical proximity to hand hygiene products, a lack of monetary reward for compliance, a lack of priority for hand hygiene practices, and individual electronic monitoring. We provided some recommendations which address these concerns, and they include providing staff with pocket-sized hand sanitizer bottles that they can just clip on. This would decrease the dependence on stationary dispensers, which might be a bit time-consuming and just overall inconvenient. Electronic team level feedback monitoring rather than individual critique. Celebrating improvements as opposed to just compliance numbers with monetary rewards such as gift cards, and requiring monetary fines for lack of improvement. Integrating hand hygiene compliance into managerial or supervisor performance would increase the sense of urgency and priority for staff to then follow. And integrating discussion into employee training and huddles with real scenarios, even facility-specific scenarios, of how patients and staff can be harmed by poor hand hygiene.